COVID-19 is a respiratory disease caused by infection with the virus SARS-CoV-2.
But the problem is it doesn't only affect the respiratory system, it seems to be a multi-system virus affecting a number of organs.
One of the things that we know about COVID is that it doesn't impact everybody the same.
It was the UK that first reported the disproportionate impact on ethnic minority health populations with COVID, and the data show that they're more likely to be affected with it, they're more likely to have more severe disease, and they're more likely to die from it as well. Long COVID is symptoms that are present after 12 weeks.
We've recruited more than 50,000 people to COVID studies, which have really had an impact. We've done some really important work here to make sure that all of our research is applicable to all of our populations.
We've been very fortunate in the Midlands. We've been funded a huge amount of funds for research, including the largest study, the UK FOSS study.
As a consequence of the pandemic, many professional groups are collaborating in a way that we hadn't done previously, and that is only going to be of huge benefit to patients going forwards.
And we're trying to bring together all the antibody data from across various studies that are already being funded to be able to answer the question definitively about how long does immunity last and what's the effect of the vaccination program on those levels of immunity in the community.
The NRC is the National Rehabilitation Centre, which is a national initiative to completely revolutionise and develop rehabilitation, knowledge, services and understanding in the UK and indeed in the world.
Digital Your COVID Recovery Programme is being rolled out nationally, and this is a platform that mirrors a supervised rehabilitation programme but clearly makes it much more accessible for a wider group of people. The development of the Your COVID Recovery platform has allowed us to deliver recovery at scale and pace.
The Patient Recruitment Centre, I think, brings more industry partners into the Midlands, so we can bring commercial trials to the region, phase 3, phase 4.
The nasal spray we've developed is incredibly potent in preventing infection. The formulation that we're using at the moment is successful in preventing infection, even at a 1 in 100,000 dilution.
The SNAP device is a small PPE attachment that fits onto a surgical mask and allows a surgeon or clinician to pass a nasendoscope up the nose and down the throat whilst the patient still wears a mask.
We have such an opportunity here to really deliver really important outputs for the country, and we've seen that where the Midlands has consistently batted above its weight, both in terms of recruitment to trial, but also leading really important research initiatives.
No one researcher, no one data set will ever be able to answer the questions fundamentally. We have to work together, we have to bring them together, the data sets together, to allow us to answer those questions in an informative and effective way and at scale.
I think we could take the lessons from the COVID pandemic to reshape the medical industry so that we can move innovations through to clinical benefit much quicker.
What I'm finding very exciting at the moment is the amount of effort and the opportunities for engineers and medics to get together and come up with new, innovative solutions that really help people.
There need to be solutions for every single type of individual, and that's something we're very committed to.
We're working on behalf of the Midlands to pull together expertise to address the health inequalities specific to the region that have been exacerbated by COVID-19 and make practical recommendations that will support the levelling up agenda.